Alright, so today we are going to work on some things for some pain relief for your left shoulder, and then we are going to work on some transfers from the bed to your wheelchair, and then also some balance exercises, and then working on getting you into bed, laying down, and sitting back up. So first we're going to do some tens for that left shoulder and shoulder blade area to help get some of the pain out of there for you. So what I'm going to do is place one pad right about here, kind of the upper trap area, and then the other one is going to go diagonal from that towards the bottom to kind of get above and below that shoulder blade. And then we'll go ahead and turn that up, and I would leave that on for about 20 minutes for him, again just to help reduce some of that pain that he's having in that left shoulder and shoulder blade area. So we'll go ahead, for time's sake, take that back off here. Next we're going to talk about a couple things for you to possibly think about adjusting at home for when you go home. So the first, you have a step to get into your house, so it might be something to think about building a ramp so it's easier to get in your wheelchair in and out of your house. You also have a little bit of a lip in your shower, so that might be something that you want to possibly level out and get a bath chair also in your shower, so that way you can just wheel that wheelchair right up to your shower and then transfer over onto that chair in your shower, and you can sit and shower and not necessarily need somebody to help you. So those are three different things to think about when you go home. Next, we're going to go ahead and do that slide board transfer into your wheelchair. So I'm going to set up our wheelchair here, and this is going to be our slide board. So I'm going to go ahead and put this underneath of you. Okay, and then have a seat. So what I want you to do is put your right hand right here for me on the end of that slide board, and then on the count of 3, I'm going to turn you towards your right, but you're going to look towards your left and use that left arm the best you can to push towards your right side. And we'll do this in 2 motions. So we'll scoot once and then we'll scoot again onto the wheelchair. Again, you're going to look towards that left side and push towards your left to move your body to the right. So on the count of 3, 1, 2, 3, push. Okay, and then again on the count of 3, and we're going to end up in the wheelchair here. So 1, 2, 3, and push. Alright, so this time you're going to lean up. Alright, this time I'm going to kind of progress this, I'm going to let you place that slide board kind of underneath of you here the best that you can. And this time, I want you to try and do most of the work yourself. I'm just going to be here just to help you if you need help. So, again, you are going to look towards the right this time now, because we are going to the left, and really use that right arm to push yourself over. So, on the count of 3, we're going to go 1, 2, 3, push with that right arm. Good. And then one more time, 1, 2, 3, push, and good. And then go ahead and pull that slide board out, and we will set it over here. I'm going to go ahead and move this wheelchair out of the way. Next, we're going to work on some seated balance. While you are sitting there, I'm just going to kind of give you some nudges in different directions, and I don't want you to let me push you over. Try not to use your arms to steady yourself, so go ahead and cross them across your chest for me. So, here we go. Good. We can do this for about 30 seconds and then let the patient rest. And we would do this a couple more times during the treatment session. Again, for time's sake, we won't go through all of it. To progress this, I would then have the patient do some reaching exercises while they're sitting there. So, you're going to go ahead and reach with the arm up and kind of lean forward for me and touch my hand. Good. And then back and get your balance. And then we're going to come over here. Reach, 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 reach. Come, come, come. Good. And then back, get your balance. Okay, how about down low for me? Good, and back up straight. And then how about back here? Good. So again, making that patient reach, testing their balance, excuse me, making sure that they have good core strength, so when they're reaching over, they don't want to feel like they're falling over, or same thing when they're reaching back. Next, we're going to go ahead and work on some bed mobility and some seated to laying down transfers. So I'm going to have you go ahead and push your arms here for me, and I want you to use your arms, and I'm going to help you scoot towards your right side a little bit. So 1, 2, 3, push. Okay, good. So what I'm going to have you do first, you're going to come down on that left arm for me onto your side. Okay, good. You're going to use your right arm to hook underneath this leg, and you're going to lift just this leg up onto the bed for me, so you might want to come down a little bit more onto your side. Okay, go ahead and hook that leg up there. Good. And then we're going to come back with this right arm and get your other leg. Good. Hook it up there. All right. So go ahead and you can move that right leg over a little bit more, and then that left leg over. All right, and then you're going to go ahead and lay on back for me. Alright, so then to progress this, to kind of work on sitting up without using your legs, what you're going to do is bring your arms, bend your elbow a little bit, okay, and this one back. And what you're going to do is push up with those hands so you're propped up on your elbows for me, so go ahead and push up. And then you are going to straighten that right arm out and shift your weight onto that side. Good. And then straighten that left arm and shift back until you're in a nice, okay, shift again, seated position. And then to swing your legs out of bed, what you're going to do is hook underneath of there and bring it off to the side. Good. And then bring that right leg. Good. And we are now in a seated position. We're going to work on some more transfer type things. So I'm going to go ahead and let you scoot forward using your arms. Okay, good. And we are going to work on, we are going to stand up, do some balance exercises, sit back down, and then you are going to hook those legs and lay down in bed for me. So on the count of 3, we're going to go ahead and stand up and use those arms to push yourself up. 1, 2, 3. Good. Stand. Okay. And then we are going to sit back down. Good. Alright, you're going to come down onto that left arm for me. A little bit more down onto that side. Okay, and then hook that leg up there. Good. Hook that left leg, bring it up. Alright, and then you're going to go ahead and lay on back. Perfect. So one more time, we're going to sit on up. So push up onto your elbows for me. Okay, and then rock onto that right side and straighten that arm out. Good. Rock onto the left side, and then rock back and forth until you're in a nice seated position. So we're going to do one thing sitting here, kind of to wrap things up. To help with some bed mobility and transfers, we're going to work on strengthening those triceps. So you're going to let your elbows bend a little bit for me, and then push straight up. Good. And then back down, little bend, push up. We're going to do 10 of those. So 3, 4, 5, 6, 7, 8, 2 more, 9, and 10. Perfect. So that will end our session for today, and that is it.